one of the more frustrating diagnoses to deal with as an athlete, and one of the most controversial to treat as a physician. I came to the calmest place I could think of to discuss gymnast wrist. Hi, I'm Dr. Randy Goldstein. Let's learn more. The first thing is that gymnast wrist is real. It occurs in athletes with open growth plates. And the growth plate is the weakest spot, so it's the place that's most likely to get injured. Once your growth plates are closed, you can't get gymnast wrist anymore. It's from impact over time, not from one day of gymnastics. And it typically happens in the upper level gymnast, as the lower level gymnast just isn't doing enough to pound on their growth plates to get hurt. If you injure your growth plate, you decrease your potential for the season, decrease the fun of the sport. Could lead to a second injury because you're not doing the gymnastic skill correctly. Can injure the growth plate, and in 3 to 7% of the time, it can even stunt the growth plate. And the growth plate could fracture or fall off. And this is a surgical problem that isn't common. We don't want it to happen to you. Here's what the athlete's going to tell you. It's not going to be from a fall or a crash. It's going to be pain that subtly starts getting worse. And if they point to their wrist joint where the wrist flexes and extends, that could be a ganglion cyst, a wrist sprain. There are things that cause pain there, but it's probably not gymnast wrist. And if it's on the ulnar side of the wrist or the pinky side of the wrist, then that's where the ulnar styloid is. And there's problems that can occur there too. You can tear something called the triangle fibrocartilage complex, the TFCC, a cartilage. Or you could have ulnar variance positive, which we'll talk about a little bit later. But it's also not gymnast wrist. Gymnast wrist is always on the thumb side of the wrist. It's always where the distal radius growth plate is. It's about 1/4 of an inch closer to the elbow than the wrist joint, where you flex and extend your wrist. If that's where the pain is, that needs an x-ray, and that needs treatment for gymnast wrist. The treatment's controversial, but most people agree that it's rest. Some people say a month, some people say up to 4 months. There hasn't been a lot of research to prove what the right answer is, but the point is to get out of pain, and so you rest as long as it takes. Most people immobilize it just to make sure that the athlete isn't doing too much, or that the coach or parent isn't asking for the athlete to do too much. Some people use a Velcro splint just to remind the athlete not to be on it. Others put a real cast on it. Usually gymnast wrist, everything's in the right spot. It just needs to rest. So the amount of immobilization probably doesn't matter. It's more the time, and remembering not to pound, not to weight bear, not to use the wrist while the growth plate is healing. Eventually return to sport, and there's a graduated return rather than going from nothing to everything. The goal is to get out of pain and get back to gymnastics and avoid something called ulnar variance positive. Who knows who gets that, but we'll look at it so that you can see why it's important not to get it. We want to avoid re-injury, and as long as you have a growth plate, it can come back. There's some questions of whether physical therapy would help or not. Once the doctors release you to start back, there's a progression back to sport. And the first week, there's typically not much weight bearing. So regardless of how long you've been out of sport, this first week back is still pretty easy on your wrists. Week 2, a little more impact is added. And then on weeks 3 and 4, we start adding back gymnastic skills and testing the wrist. If there's pain, we need to back off. No pain, keep progressing. A picture's worth 1,000 words, so let's look at some x-rays so we can learn a little more of what gymnast wrist looks like. This is a normal wrist. The growth plates are open and they're symmetric. The growth plate of the radius, the larger wrist bone, looks about the same as the growth plate of the ulna, the smaller wrist bone. This is an x-ray of an athlete with gymnast wrist. Notice how the radius growth plate is wide. It's not crisp and clean like that of the ulna. They should both look similar. It may be subtle. It doesn't look like falling out of a tree and breaking your arm. So if a radiologist or doctor isn't used to looking for gymnast wrist, they may read this x-ray as normal, but it's definitely not. Just because the x-ray may look subtle, or a doctor may even call it normal at first, doesn't mean that it doesn't hurt, or that it's not dangerous, or that we shouldn't treat it. Sure, it doesn't look like a fall out of a tree fracture, but have you ever had pink eye or a paper cut and then put lemon juice on it? That's doing gymnastics with gymnast wrist. It's painful. It needs to be taken care of. Or you can't get your mind off that problem, and it can cause other problems. If you're not doing the skills correctly because your wrist hurts, you could get a second injury. We have to treat it, and we have to try to prevent it from coming back. Okay, here's the normal wrist, a thin, crisp growth plate at the distal radius, similar to the ulna. Here's the gymnast wrist, wider, not as clean looking as the distal ulna. And here's a gymnast wrist where the growth plate fell off. It slipped this direction. That's a surgical problem and something that we definitely want to avoid. If we're having pain here, we got to start treating it before we get here. This isn't a common problem, but we definitely want to avoid it. We're doing great. Let's keep going. This x-ray is an athlete that's almost done growing. The growth plate's just a small crack where it used to be an opening. The heights of the radius and ulna have a smooth transition. Imagine if you were a tiny skier on this radius and ulna, skiing down the heights of the bones. It's a smooth transition. No bunny hills, no jumps. Even if this athlete had gymnast wrist, this is the normal outcome and a normal x-ray. This is the result that we want. This athlete's done growing. They're skeletally mature. When they were younger, they had gymnast wrist. And unfortunately, they also got ulnar variance positive. The ulna continued to grow, and the radius arrested or forgot to grow after the gymnast wrist. You can see here with the green line and the blue line where the radius and the ulna borders should have ended up. But in this case, the radius border is lower than the ulna border. And if we use that analogy of the little skier going down the green line, here there's a bunny hill or a jump. This isn't the way it was supposed to end up. This is called ulnar variance positive. Here are some of the problems that occur with ulnar variance positive. The yellow line should meet up with the blue line, but because the ulna kept growing and the radius forgot to grow or was arrested, it resulted in the yellow line where the radius is shorter than the ulna. The red stars simulate an area where the triquetral bone of the wrist bump into the ulna, and this can cause bone bruises or bone marrow edema. This can be painful. This is an MRI with an athlete that has ulnar variance positive. Notice the blue arrow. It's pointing to a torn triangular fibrocartilage complex, or TFCC. It's a cartilage that can get injured if the ulna pokes through it or is too tall. The red arrows show bone marrow edema or stress injuries at several of the wrist bones bumping into the ulna. This is called ulnar impaction syndrome and can be painful. Now, we don't know how to prevent gymnast wrist from becoming ulnar variance positive, and thankfully it only happens 3 to 7% of the time in athletes that get gymnast wrist. But if we can prevent it, we certainly would want to, because this can be painful and it can result in needing surgery. If you have ulnar variance positive and you don't have pain, the treatment is to do nothing. But if you have ulnar variance positive and you can't do what you want to do, or you're having too much pain, then you have to have a surgery to shorten the ulna. And this is a big time surgery. Here's before the surgery with ulnar variance positive. The radius is shorter than the ulna, which has to bump up. After the surgery, they've shortened the ulna, and now the radius has a smooth transition to the ulna. This athlete doesn't have ulnar variance positive anymore, but they also have a big time surgery. Preventing gymnast wrist would be great. The only way to 100% prevent it is not to put weight or impact through your wrists. And if you're a gymnast or in circ, it's unlikely you're going to be able to do the sport without ever putting weight through your wrists. Some people try tiger paws. The research is mixed on whether tiger paws actually help prevent growth plate injuries in the wrist, but some people try it. Watching your technique is important, and sometimes physical therapists get involved. Watching your technique to make sure that your wrists, elbows, and shoulders are working correctly. Imagine if equal weight should be put through your wrists, elbows, and shoulders, but because of your flexibility or because you have bent arms, more weight is going through your wrist. You can imagine how you might get gymnast wrist, but another athlete doing the skill with better technique may not. Gymnast wrist is a growth plate injury. It's also called an epiphysealysis or a Salter-Harris 1 fracture. It occurs in gymnasts and Cirque du Soleil athletes, those that have recurrent impact or weight bearing through their upper extremity. And it can occur more than once until your growth plates are closed. The treatment is rest, and most people recommend immobilization during this time. The amount of time is controversial. Some say a month, some say 4 months, but the goal is to get out of pain. If you're having wrist pain, getting a good diagnosis to be sure your growth plates aren't involved is important. And if they are involved, to get the right treatment. In a minority of the time, 3 to 7%, ulnar variance positive occurs. It's when the ulna continues to grow and the radius arrests or forgets to grow. Rarely this requires surgery. Gymnast wrist is frustrating. For the athlete, it's painful and it slows down practice. It's frustrating for the doctor too, because the treatment is controversial. But it's clear that if your growth plate is injured, it needs to be rested, and we need to give it the best chance to develop normally. I'm Dr. Randy Goldstein. Be well.